I said, good morning, everyone. And welcome. It's day 2, so that means that you're here to hear everything that we're going to talk about and that you're excited about learning about oral health. Again, I'm Dr. Jonise McDaniel, and I'm serving as the Public Health Dental Director for the Oral Health Program. I want to extend my heartfelt thanks to each and every one of you for your dedication and passion for enhancing oral health of all the residents of Pennsylvania. The incredible work that you're doing is invaluable, and thanks to you and your efforts, we can effectively put the oral health plan into action. For today's agenda, I'll provide an overview of the state oral health program, discuss the importance and relevance of oral health, examine the current state of oral health in Pennsylvania, explore the Pennsylvania Oral Health Plan 2020-2030, and I'll highlight some of the exciting projects that we're working on. Now, the Pennsylvania Department of Health Oral Health Program plays a pivotal role in shaping oral health in our state. In the next 2 minutes, we'll delve into the key functions and elements of the state oral health program. Let's begin with a fundamental understanding of what a state oral health program is all about. One of the primary roles of the state oral health program is to unite stakeholders from diverse backgrounds who share a common goal: the promotion of evidence-based oral health interventions. This collaboration and coordination ensure that our efforts are harmonized for maximum impact. We're about data-driven decision-making. We collect, compile, and share essential surveillance data related to oral health. This data provides crucial insights into our state's oral health landscape, helping us identify trends, challenges, and areas that require intervention. But we don't stop at data collection. We are also committed to implementing public health policies and systems interventions. These actions are designed to improve oral health outcomes on a broader scale. We address issues such as access to care, prevention, and education, aiming to create lasting positive changes in our communities. Now let's shift our focus to the dedicated individuals behind the scenes. We have Jan Miller. She provides crucial insight, and she manages the CDC grant, while Sarah Welch, she administers the HRSA grant and block grants. We also have 2 esteemed consultants, Dr. Andrea Abbott and Dr. Harry Goodman, who provide evaluation and dental expertise. And we can't forget our key partner, the Pennsylvania Coalition for Oral Health. Their collaboration is instrumental in our efforts to promote oral health throughout the Commonwealth. Together with PCOH, we are forging the path towards better oral health for all residents of the Commonwealth. You, as experts in the field, already understand deeply how oral health is not isolated from the rest of one's health. It's intrinsically connected to our overall well-being. Oral health is the window to overall health. Our battle against Streptococcus mutans is not isolated to the oral cavity. It's closely linked to various systemic diseases and conditions. For example, endocarditis can result from strep mutans and other culprits from the mouth entering the bloodstream. Cardiovascular diseases, including heart disease and stroke, are associated with inflammation and infections caused by these oral bacteria. Poor oral health can especially periodontitis, can be linked to adverse pregnancy outcomes, such as premature birth and low birth weight. It affects both maternal and fetal health. Surprisingly, oral bacteria can find their way into the lungs, leading to pneumonia and respiratory conditions. This connection underscores the importance of oral care, particularly for our individuals with weakened immune systems and those at risk for respiratory infections. Now, emerging research has now linked Alzheimer's disease. There's a link between Alzheimer's and oral health. We often see cognitive loss as we age based off of poor oral health. There's a link with that, okay? We recognize that this is important that oral health is more about preserving, not about preserving our beautiful smile, but about safeguarding our entire body. Now, looking at Pennsylvania's dental visits in 2020, we were reported at 68.1%, placing the state 15th in the nation and above the national average of 66.7%. You look at this and you think, not bad, right? Well, this is a self-reported phone survey, so we know that these numbers are probably inflated because people aren't going to necessarily feel so confident about saying that they haven't gone to the dentist when it's something that they know that they should do. Now, examining oral health disparities based off of race ethnicity for individuals who did not visit the dentist in the last year. In 2020, we can see some notable differences. 32% of all adults did not visit the dentist in the past year. Well, with Hispanics, we can see 37%. And with our Black community, we can see that 42% did not visit the dentist. So these disparities underscore the need for targeted interventions and policies aimed for improving oral health access and equity, particularly among minority populations. Now, the 2020 data reveals a stark income-based disparity in dental visits. 54% of those earning $15,000 or less did not see the dentist, compared to 21% of those making $75,000 or more. The data indicates a clear trend. Lower income correlates with a higher likelihood of not having visited the dentist. Now let's take a look at the dental HPSAs. Across the state, we have 161 dental HPSAs impacting nearly 2 million Pennsylvanians who face challenges in accessing dental services. Only 36% of dental care needs are currently being met in the state. So we need an additional 338 dentists to resolve these shortages. Sounds easy enough, but where are we going to find these providers and how are we going to get them into these dental health professional shortage areas? We don't know the answer to that. Now, moving right along with painting the picture of our state, we'll outline a few measurable indicators for oral health between the years of 2020 and 2021. In 2020, roughly 44% of pregnant women received preventative oral care, which slightly improved to 45.2% in 2021. Now, for children with special health care needs, there was a more substantial increase in preventative care from 32% in 2020 to 35.8% in 2021. The 2030 goal is 38%. The data for reducing the incidence of tooth loss in seniors over 65 remains pending in 2022. And the goal is for 2030 is 65%. Reducing untreated dental decay in children has a baseline of 25.8%. The rate of, this is an area of critical need that needs addressing. And the goal for 2030 is 22.8%. Now, the number of dental HPSAs county level designations is held steady at 41 for all 3 years. Now, overall, while looking at these numbers, we see that there's been some improvements in some areas. However, the picture suggests that Pennsylvania needs to continue investing in oral health initiatives, particularly those for the most vulnerable populations. That brings me to the Oral Health Plan 2020-2030. Now, as defined and communicated by the oral health stakeholders and partners throughout the Commonwealth, Pennsylvania's oral health plan can be grouped into 3 priority areas: access, prevention, and education, workforce, and infrastructure improvement. The plan defines 5 overarching domains in which to view each of the oral health priority areas. The first 3 years of the plan focus mainly on achieving the structural domains of health infrastructure and health surveillance and evaluation. As we move towards year 4, the focus of the plan shifts to the achievement of oral health goals in health equity, health policy and advocacy, and health community. Within the 3 priority areas and 5 domains is a subset of 22 goals referred to as measurable outcomes. Though the priorities and domains remain unchanged throughout the term of the plan, within the specific measurable outcomes, there's a subset of individual strategies that are determined annually by the Oral Health Plan Advisory Group, also known as the OPAG. Now, our current action steps for the 2023-2024 that have been selected by the OPAG, I'm not gonna read through all of them because they're waving up the sign. But I do want to talk about our HRSA grant. So it contains 4 overarching goals: workforce development, expansion of dental services, expansion of dental workforce infrastructure, and to strengthen the oral health leadership. Now, the CDC grant focuses on decreasing dental caries, oral health disparities, and chronic conditions linked to oral health issues. The state oral health program tackles these challenges through managing the school sealant programs, supporting and increasing access to community water fluoridation, conducting oral health surveillance, for example, the BSS, which Kelly Braun talked about yesterday. Now, one of the reasons the oral health program has been able to accomplish the goals over the last 5 years is due to receiving a grant through the CDC for oral health. This was the first time that PA received this type of funding in decades. And that grant is coming to a close in August of 2024. So we're gearing up for the next round. Only 16 out of 59 states and territories will be selected. So we will be reaching out to many of you for letters of support. Our goal is to be able to show that we have a strong infrastructure and that we're willing and able to make some changes and that we're striving towards positive impact for our communities. We have to be able to show that we're prepared and collectively aggressively able to combat oral disease. The oral health program is looking to build and strengthen relationships with other state agencies to align our goals. Currently, we have a close relationship with the Department of Human Services, and we're working towards how better to integrate our efforts. We're very interested in the Department of Aging's 10-year plan, and we see Pennsylvania's aging population as an area that needs more support. As we conclude our exploration of the state oral health program, we've unpacked the critical importance of oral health as a pillar for overall health and well-being. We've surveyed the current landscape across Pennsylvania, and we've charted our course with the ambitious oral health plan. We stand at a juncture where understanding meets action. Join us in emphasizing the importance of oral health as a key component of overall health by demonstrating the impact of our programs, engaging in educational initiatives, and participating in stakeholder collaborations. We've made great strides with your support since the first Oral Health Summit in 2016, and that is a testament to the strong support we receive from our oral health stakeholders. Your advocacy and engagement have been instrumental in putting our oral health program on the Department of Health's agenda. While the oral health program itself does not lobby for specific legislation, we provide information to legislators we give them the knowledge needed to make informed decisions about oral health. You, as our stakeholders, are the voice for OHP, advocating for our mission and in sharing impactful stories that highlight our collective mission. Together, we're committed in our mission to deliver optimum oral health in all of the Commonwealth. We are working to promote health equity, reduce disparities, and combat oral disease. Thank you for your dedication and joining us for this movement. We definitely know that with your support, we will be able to improve the oral health of all Pennsylvanians. Thank you.